You are listening to the PFAS Research and Remediation podcast series produced and created by Arcadis, with funding from the Environmental Security Technology Certification Program, ESTCP grant number ER23-7692, through the United States Department of Defense. All opinions, interpretations, and conclusions expressed belong to the hosts and guests and do not represent the views or policies of the Department of Defense. In our second season, we interview a broad panel of experts who have each contributed to the growing knowledge base around remediating this emerging chemical of concern.
Today we're joined by Dr. David Moore from U.S. Army Corps of Engineers Engineering Research and Development Center. David, thank you for joining us.
Well, thank you for having me.
Thanks, David. I think we could dive in a little bit to your recent project, ER20-1542. That's titled Supplemental to Industry-Sponsored Multi-Generational PFAS Exposure. Would you mind just providing a summary on the purpose of that and maybe the backstory? How did that project come about?
Sure. It's actually a very interesting backstory. In circa 2017, 2018, we were approached by the Sediment Management Work Group, which is a coalition of Fortune 500 companies that have large contaminated sediment sites that they have to address. And there was a concern among the members that a recent publication by Keeter et al. Had been adopted and utilized in Australia by the Victoria EPA to derive aquatic life criterion. And the resulting criterion was in the range of 0.23 nanograms per liter, which is at the time and still currently anywhere from 100 to 1,000-fold lower than any other criterion that was in existence. And so it gave pause to industry because they didn't really understand how this one study could drive the risk profile to that degree. So initially they asked us to review the study. We did review the study. We identified some significant issues with the study for this particular application. Bear in mind, the study was never intended nor designed for derivation of a regulatory criterion. Okay. It was a study to look at PFAS and BPA, and it was a small number of replicates, 2 replicates per concentration, and I believe they only ran 3 concentrations that were fairly widely distributed. So challenging to utilize information out of a study that's been designed that way to support development of a regulatory criterion. So they then asked if we would be amenable to repeating the study, and we indicated we would be, but we wanted to ensure ultimate regulatory acceptance. So we organized a workshop with EPA representatives, industry representatives, and certainly core scientists to talk about development of a very robust and defensible experimental design to ensure that at the end of the day, the results that we got out the back end would provide a level of clarity around where the effect level was. And at the end of that workshop, we came up with a study design. And then I then approached Certip ESTCP and indicated, hey, we've got a project that industry is willing to fund. The other aspect of this particular study is it was a multi-generational study. So you're talking about a study that the exposure runs almost a year, well, over a year, 375 days was the duration of the exposure. We ran through 2 generations and then into a third generation over the course of that study to look at potential generational effects of long-term exposure.
So had that been looked at previously, or was that
that was done
of the design?
That was done in the original Keeter et al.
Yep.
Which is obviously why we repeated it over that kind of a duration. But it's not something that is typically done for obvious reasons. I mean, it's quite expensive. There's a lot that can go wrong over the course of those kinds of study durations. So you've got a huge investment that's fairly high risk, which is part of the story and engagement with Certip ESTCP. We said we've got an industry coalition that wants to pay for this study. Their interests are very much focused on sort of survival, reproduction, and growth endpoints. Yeah. But we feel like we're going to be collecting all this data. There's opportunity to do much, much more with these organisms as part of the study. So Certip ESTCP was very interested in it and contributed and supported the study to enable us to be able to look at histopathology, bioaccumulation, bioconcentration, RNA sequencing data, so that we could actually look at potential underlying mechanistic pathways and those kinds of things.
And what are some observed effect that you can see in a multi-generational study that you would simply miss if you didn't have that?
Well, one thing is sort of ultimate reproductive success. When you're in ecotoxicology, we're always concerned about the viability of populations, right? And we're trying to extrapolate that from often short-term studies that are only looking at maybe survival. In best cases, sometimes we include a reproductive endpoint, but we really don't follow those endpoints further out to see if the effect is manifesting itself in a more subtle way that ultimately will result in a population collapse. So you might not see an effect in the first generation, but the second generation, as a consequence of that first generation's exposure, is less fit. And then by the time you get to the third generation, all of a sudden you've got a reproductive collapse or the animals are no longer.
So you hinted at it, but maybe you could just provide again an overview of the experimental design, sort of how was it structured and, the major aspects, and to the degree that you can sort of tie it to hypotheses or things you're really trying to test.
Sure. As I mentioned at the outset, the Keeter et al. Study wasn't really designed or intended to be used for derivation or regulatory criteria. And so they had small number of replicates per concentration. They only ran 3 concentrations that were fairly widespread. And so in our discussions as part of the workshop that we had with EPA, we batted around what we thought would be a more robust design to enable us to be able to get at sort of these threshold level responses in the organism. So we wanted to run at least 5 concentrations. We recognized, because of the results of the Keeter et al. Study, which showed growth effects at 0.6 micrograms per liter, that we needed to have concentrations that sort of bracketed that and then went higher. We ran at a high enough level where we might see an effect. So we ran from 0.1 microgram per liter all the way up to 100 microgram per liter. In addition, we had 5 replicates per concentration series. We had somewhere in the neighborhood of 50 fish per tank initially, and at reproductive stage, then went into the tanks and culled and ensured that we had an equal number of males and females to follow. The system was a flow-through system, and that was also a little challenging in terms of ensuring that we're maintaining a constant concentration over that kind of an exposure duration. And of course, if you're using PFAS and you're operating at that range, we had to actually have a filter system on the front end to remove residual PFAS that would be associated with sort of laboratory plumbing to ensure that what we were dosing was just PFAS and not other components.
Yeah.
And then obviously on the back end, we also had a treatment system that removed the residual PFAS once it went through the exposure system.
Yeah.
And so then, at 180 days, we ran through a series of reproductive trials, I think a total of 8 at each concentration, and looked at reproductive success in terms of producing eggs and egg viability. And then we took a portion of those fertilized embryos, allowed them to develop over like a 16-day period, and then essentially started the experiment over again for the second generation. And then essentially went through that whole exposure design for the F1 generation. And then at the end of the F1 generation, we again ran a series of reproductive trials, looked at egg viability, and then grew that F2 generation out to 16 days post-fertilization just to make sure that we didn't track them out, again to reproductive success, but we just tracked them up to viable juveniles.
Okay.
So in the male fish at the highest concentration, 100 micrograms per liter, we're getting activation of PPAR, which is a molecular receptor which is responsible for steroidogenesis. And that in turn affects cholesterol and fat production and other kinds of things that leads to the fatty livers that we observed in the male fish at that highest concentration. I guess the good news story that came out of this study was that in this more statistically robust design, we did not see any impacts on survival, growth, or reproduction that were statistically significant. We did see indications of reduced survival at the highest concentration and indications of reduced growth at the highest concentration.
Hmm.
But neither of those manifest themselves in terms of reproductive impacts to reproductive success.
Okay.
So
So
in my
smaller-
opinion, I think we were sort of at the cusp of where one might begin to see effects. So if you went above that 100 micrograms per liter, the effects were subtle enough that they weren't manifesting themselves in a reproductive way. But if we'd gone a little higher, we might have seen a significant diminution in reproduction.
Yeah, interesting. So tying it back to the original storyline, how does this connect into risk and practical use in real world scenarios and regulatory acceptance?
Right. Great question. So the study was 375 days of exposure, and so it took quite a long time to run the study and then actually work through the results. And while that was happening, US EPA was developing their ambient aquatic life criteria document. But because of their involvement in our study and what they were seeing in our results, they excluded the Keeter et al. Study in their derivation. So they came out with a value that was much more in line with other values. It also triggered a review by Victoria EPA of their ambient water quality criterion. And so, as you remember, I said the Keeter et al. Study showed an effect at 0.6 micrograms per liter in one of the generations for growth. And by the time that you plugged that into their model and added the safety factors across their safety distribution, they ended up with an aquatic life criterion of 0.023 nanograms per liter, which was significantly lower than what others had been finding. And so after we ran the numbers and said, okay, if you exclude the Keeter et al. Data and just ran with our data, that would be closer to like 1,300 nanograms per liter. Now, that's not where they ended up in their revision. I think they actually kept, in the latest version, they actually kept the Keeter et al. Study in there, but the use of our data was weighted more heavily, and as a consequence, they're in like the 3 or 4 nanogram per liter range, which is a little bit easier to deal with.
Yeah. Well, David, this is a great study. Congratulations to you and your team. We covered a lot of ground. Was there anything in your study or more broadly as it relates to the need for ecological risk assessment and supporting data for the PFAS problem that you'd like to comment on?
For me, it was illustrative of the fact that in the derivation of these regulatory criteria, the regulators are surveilling the literature and just sort of pulling everything they can. And it's not to say that there isn't a lot of rigor in evaluating those studies and sort of doing a quality check on the studies, but I do think it points to the need to be very careful about which studies get incorporated and how they're utilized. And I don't recommend that we do multi-generational exposures for every compound, but I do think those kinds of studies do have value where you have some indication that there may be untoward effects in later generations, and you need to sort of tease that out to better understand whether that in fact that is the case or not.
Well, this has been a great conversation. Thank you so much for your time, David.
I appreciate it. Thank you.
Thank you so much for listening. This podcast was funded by ESTCP and produced by Arcadis. The interview was conducted by Craig Devine, and our guest today was Dr. David Moore. If you're interested in more information on David's project, please visit certup-estcp.org and search for the project number ER20-1542. If you have conducted your own research on PFAS and are interested in sharing your work, please email Teresa Gillette at teresa.gillette@arcadis.com. That's TheresiaGillette@arcadis.com. And please keep an eye out for more episodes coming soon.